Welcome back to another video tutorial over the low vision proficiency. In this tutorial, we're going to go over how to either perform or to grade the Colenbrander near acuity test. So this is another acuity test, just like the lay numbers or the ETDRS that we've already discussed. So a lot of the points during the course of the proficiency are going to be very, very similar. There are a few differences that I'll highlight as we go through this video tutorial, but let's get into it. So the Colenbrander test, or the Colenbrander near acuity test, is a card that we use often in low vision exams. It's very similar to the ETDRS chart in that the letters have a uniform progression as they move down or to smaller and smaller optotypes. They also have fairly even spacing. They are made up of Sloan letters, so they are all of equal difficulty. And they also and the card also has a high contrast side and a low contrast side, which is different from some of the other acuity tests that we have looked at. As far as the clinician responsibilities for this test, just like on the other two visual acuity tests, they are supposed to explain the purpose of the test to the patient. So we can keep it fairly simple, and they can tell the patient something along the lines of, today we're going to check your near acuities. We're just looking to see how well you see up close. The clinician should also instruct the patient on how to perform the test. And so what they typically will say, or what a student should say, is, I want you to hold this card at your habitual reading distance, or the reading distance that you normally use while you're wearing your reading glasses. In just a few minutes, I'm going to ask you to start reading letters from the top, and then you work your way down the chart until you can no longer see the letters. In this particular case, or with this particular test, we are not going to have the patient occlude an eye. So normally in low vision clinic, we'll test each eye individually. However, for testing purposes, we're just going to have them use both eyes for this particular test. As far as room setup is concerned, the clinician should have the overhead room lights on, and they should also have the stand lamp directed at the card. So, it may be beneficial for the clinician to ask the patient if the lamp is in a proper position that is not causing a lot of glare or reflections off of the chart into the patient's eyes. So that's sometimes a nice thing that the clinician will ask the patient. Again, one thing that I want to note is that for the Colenbrander card, there is not a set test distance. So the clinician does not have to set the card at 40 centimeters or 50 centimeters or some exact distance. Instead, what they should do is they should ask the patient to hold the card at the distance that they normally use for reading. Once the patient has set the card at their normal habitual reading distance, the clinician needs to measure the card. And this is a very key point to this test. They need to measure the distance from the patient's glasses to the card. We need to know the working distance in order to properly record visual acuities. If this is not done, or if the clinician selects a specific distance for the patient, they should lose some points for this because it has been discussed thoroughly in class. So just like the other test, the patient is going to start at the top of the chart and work their way down. The clinician should encourage them or push them down the chart, trying to get them to see the smallest optotypes possible. It's okay for the patient to guess, and it's okay for the clinician to ask the patient to guess. There's no penalty for wrong answers. So as they move their way down the chart, again, clinicians pushing them down the chart, encouraging them to get smaller and smaller optotypes. There's no exact set stopping point. However, just like with a Snellen acuity test, or if you've ever used a reduced Snellen card, the patient's going to get to a point where they can no longer see letters. If at this point, hypothetically, the patient were to start guessing and were to get, multiple letters wrong, 4 or 5 letters in a chart or something like that, the clinician could ask the patient to stop, and that could be the conclusion of the test. However, most of the time, the patient tells the clinician, oh, I can't see any more letters. the clinician may ask at that point, are you sure? Are there any that you want to guess at? And if the answer is no, that's an appropriate point or an appropriate place to stop the test. I'm going to share my screen real quick here so that you can see what this particular chart looks like if it's not familiar to you. So this is the Colenbrander mixed contrast card. And a couple things that I want to note here. Do not pay attention to this number up here. And so I know that it has a specific distance that's specified for the card. The only time that that distance would be valid is if you're going to use the Snellen acuities that are listed over here on the right-hand side. And so these would be equivalent to reduced Snellen. And because of that, the card has to be held at a very specific distance for that acuity to be valid. However, for the purposes of our test, we don't need to worry about holding the card at a specific distance. The patient should be holding it at their habitual working distance. So in this instance, what you can see here is that on the left side of the card, we have 100% contrast. And on the right side of the card, we have reduced contrast, which is somewhere around the 10% level. So the patient is going to read down as far as they can over here on the 100% contrast side. Once they get to a point, they can no longer see the letters. Let's just say, for instance, this is the last line that they're able to read fully, and then they can't see any letters here or beyond. Once they reach this point, the clinician should ask them to look over on the right side of the chart and then read down as far as they possibly can over here. It's also appropriate if the student asks, can you see this line? Oh, I'm sorry, hold on. It would also be appropriate if a student asks, can you see this line here? And if the patient can read that, that's totally fine. And that's a good point, or that would be indicative of a completely normal contrast sensitivity. However, what the clinician may say is, now I want you to read over here on this 10% contrast side, and I want you to read down as low as you possibly can. Let's just say, for instance, that the patient is able to read down to this point right here and no further. What we're looking for on the right side of the chart here is loss of visual acuity or loss of lines of visual acuity. So whenever we reduce the contrast, if the patient is having problems with contrast or has contrast impairment, there may also be a reduction in spatial acuities or the ability to see small letters. So what we're looking for with the Colenbrander card is a loss of 3 lines or more indicates contrast impairment. So if the patient were able to read a 2.5 M line over on the 100% contrast side, and then over on the 10% contrast side, they lost 1, 2, 3 lines, this would indicate that they have some amount of contrast impairment. And the clinician should communicate with the patient as part of their explanation of results, which is a little further along in the test. If, however, they're able to see this line or any of the lines below, we kind of highlight a couple more here, then that would indicate a completely normal contrast. So that is something that the clinician needs to be aware of, and it's something that they need to explain to you, the proctor, and to the patient as part of their proficiency. Let's go ahead and take a look real quick here. Let's use this as a specific example, and I'll show you how this test would be recorded in Revolution, and then I'll actually show you in Revolution how we would write this acuity or record this acuity. So let's just leave this up as the example. Let's say that the patient was able to read down to the 2.5 M line, but when they were doing this, they were at 37 centimeters. So what we're going to do is we're going to record the test distance in meters. So we would say 0.37, and then we would say over the optotype size the patient was able to read. And so in this case, 2.5 M, 0.5 M would be the acuity that we would write down or that we would type into the visual acuity box in Revolution. So note right up here that this is kind of an odd number, and that's okay, because what the clinician should do whenever they ask the patient to hold the card at their habitual reading distance is get out the tape measure and measure this distance. And so in this case, in this hypothetical example, the card that the patient was holding, or the distance the patient was holding the card at, was 37 centimeters away from the spectacle plane. And so in this case, we would say 0.37. We list the distance in meters, just like we did with the SNO or with the ETDRS acuities earlier. So now let me remove this real quick. Now let's say that, for instance, the test was at 42 centimeters and the patient was able to read all the way down to this line right here. So in this case, the patient was able to read all the way down here. They weren't able to read anymore. So in this case, what we would say, and it was at 42 centimeters, so we would say 0.42 over, and the line that they read was 1.6 m. And that's the way the student or the clinician rather should record this in the patient's chart. So let's just think of an example. One of the things that we don't necessarily do with this, well, one of the things that you can do rather with this test is if the clinician wants to count letters just like with the ETDRS chart, that's perfectly fine. And so along that same line, we can do an acuity similar to what we did before, where, for instance, if the patient was able to read down to this line here, and one more line, so they weren't able to see anything here, but they were able to pick up this additional H, then you could say whatever test distance it was conducted at, let's just say 35 centimeters. So in this case, you could write the acuity as 0.35 over 1.6 m plus 1. And so that would be an appropriate visual acuity that they could record in Revolution. Speaking of that, if we go to Revolution here, and we go to either the aided or unaided acuity pod, so we're in the same place that we were for Leah numbers and for ETDRS. One thing that Revolution has wrong in both the sandbox and the live version is the way that they list the optotypes. So they list the optotype first, or the way that they list the acuities rather. So they list the optotype size first, followed by the distance. This is wrong, but unfortunately, it's the way that it is in the system. So let's use the drop-down box here. And, if the patient was at 35 centimeters, that would somehow was their habitual reading distance, they can put this in the drop box, and then they were able to read 1.6 m. That's how they could record that, and that would be perfectly fine. They should also use this drop-down and say Colenbrander mixed contrast here. However, in instances where they don't have the exact distance or the exact M acuity, just like before, we could put this in the notes. And so we can say Colenbrander, OU. And so in this case, let's say that it was conducted at 37 centimeters. You can say 0.37 over 1.6 m, and then say +1 if they were able to read additional letter, just like what we were talking about before. This would be a perfectly appropriate way to record this. Now, one thing to note real quick, let's go back to the Colenbrander card. And so in this instance, let's say that they were able to read this down here, and they were able to read this one over here. What the patient would record, and so note that this is 3.2 m here, and it is 1, 2, it's 3 lines above visual acuity. I'm sorry, 1, 2, it's the 3rd line above visual acuity. So this would be considered an abnormal contrast loss in this case. But what the clinician should record is it should be conducted at the same test distance. And so they can write 10% contrast, and then they could say OU. So we'll keep it at the same test distance as before, which should be the case, over, let me go back and look here, 3.2 m, 3.2 m, and this we would say, we would note impaired contrast sensitivity. So if, for instance, the patient was able to read within 2 lines of their 100% contrast, we would write normal contrast sensitivity here. And effectively, that's the way in which we would conduct the test. and recorded in Revolution. The last part is always competency, and so I'll leave that up to you, the proctor, to determine if the patient or if the clinician conducted the test in a professional manner. But that is it for the Colenbrander card. If you have any questions, please contact me or Dr. Ma, and we'll do our best to answer them. Thank you very much, and see you on the next video.